Hello, everyone. In this Black History Month, we want to discuss anti-Black racism in nursing and strategies for addressing anti-Black racism in nursing. I'm Dr. Bukola Salami. I am a registered nurse and a professor of community health sciences at the University of Calgary. And joining me today is my colleague, Dr. Florence Luhanga, who is an associate professor at the Faculty of Nursing. Dr. Luhanga is a leading figure in Canada on anti-Black racism in nursing education. She's currently completing a SSHRC-funded project on Black nursing students. So I would like to welcome Dr. Luhanga.
So before I start, I would like to acknowledge that the University of Regina is situated on Treaty 4 lands with presence of 26 territory. These are territories of the Cree, Saulteaux, Dakota, Lakota, Nakota, and the homeland of the Métis. Today, these lands continue to be shared territory of many diverse peoples from near and far. We recognize the contribution that engaging in reconciliation brings to our life as a campus community that is situated on this land. I would also like to acknowledge our Black Canadian nurses, heroes, who paved the way for us to be where we are now. Thank you.
Dr. Luhanga, can you please tell me about current and past research you have done related to Black nursing students?
So my current research examines recruitment and retention of ethnic minority students, specifically Black student success in undergraduate program education through a critical race theory and intersectionality lens. I also engage in research on the experiences of Black faculty members in academia. As one of the leading voices for promoting equity, inclusion, and diversity in the integration of racialized students and faculty in Saskatchewan, Canada, I see my contribution to the body of nursing knowledge and education as using evidence to inform meaningful supports for students to provide positive learning experiences for them, as well as to increase retention and success rates of Black nursing students. So these are my research projects that I've been involved with, specifically with Black students. So in 2001, I led an internal funded project on recruitment and retention of Black students in nursing programs. We used focused ethnographic design grounded in critical race theory and intersectionality to explore the experiences of Black students in two Western Canadian undergraduate nursing students. Data were collected via virtual semi-structured interviews and one follow-up group. This is because that was the time of the COVID, so we could not do kind of no face-to-face. 18 participants participated, 16 female and 2 were males. 10 were current Black nursing students, 2 were registered nurses, and 6 had withdrawn from the program for various reasons. So the results, 6 overlapping themes emerged from data analysis and interpretation. First was systematic racism in nursing, so racism in the classroom and clinical environment, such as unsupportive clinical environment and realistic workload for Black students and isolation and lack of voice. And then the second one was precarious immigrant context. So, for example, this is related to microaggressions related to accent. So if you have an accent, then it's an issue. The third was mental health and well-being concerns. So these were, because based on whatever they were facing, some of them talked about mental exhaustion, trauma, and some even talked about, suicide attempts, and then withdraw from the program. And then number 4 was challenge and barrier to success. So this one involved institutional and program barriers, such as lack of diversity, especially Black representation, lack of support, and individual barriers such as lack of preparation for the program, and then work-life school balance was also an issue. And then number 5 was coping mechanism. So we asked them what strategies did they use. So they talked about resilience and hard work, faith in God, presence of family and friends that really helped them. And then they also came up with recommendations to improve the delivery of the program. This included introducing mandatory anti-oppressive workshops for faculty members, instructor students, administrative support to mitigate barriers faced by Black students, increase diversity in the program by hiring more Black faculty so that they can serve as mentors, and also Black advisors who can advocate for Black students. They also talked about creating platforms for safe space for health dialogue, and also creating culturally sensitive learning-centered programs and responsive supports. So then the second one, or the current research project that I'm working on, this is still in progress. So in this one, as a PI, I have partnered with a team of Black researchers across universities and polytechnics in Canada to conduct a study which is entitled Reviewing Black Undergraduate Nursing Students' Experiences in Saskatchewan Programs. In January 2023, we received ethics approval from affiliated institutions and started recruitment of participants in February 2023. Currently, we continue with recruitment, and then we are also doing data collection and data analysis. Today, we have managed to recruit 23 participants. So the emerging themes or findings are confirming and expanding on the findings from the pilot study that we did. And it continues to show that some students are now choosing to use their voice rather than being silenced, even though others still feel silenced and fearful to speak up or talk about their challenges. And in anecdotal experiences, like recently, some of the students who are reporting challenges in clinical experiences that we have actually intervened, like from both programs, challenges in clinical experiences, and these also relate to students being questions on topics such as how many children do you have, or where do you come from, accent mistaken for language barrier, and then also, they don't want to speak up because of fear of reprisal. And also some of them say that they are scared to speak up because fear of being labeled as aggressive. So as a Black nursing scholar, I believe that nursing faculty, nursing education, program administrators, practice partner leaders, and nursing organizations have got a critical role to play in promoting equity and contributing to diversity in nursing profession. This work builds on my research agenda of ensuring better equity, diversity, and inclusion of Black population in Canadian places. And then I wanted to add that my next step is to collaborate with other researchers from other universities and colleges to conduct a nationwide study of Black nursing students' experiences in the Canadian undergraduate programs.
Dr. Luhanga, what is the experience of Black nursing students in educational settings?
Thank you. So we are going to concentrate on the theme number 1. The main thing is racism or systematic racism in nursing. So racism in the classroom. These are in relation to microaggressions or discrimination against Black students, For example, being taught by a professor that if your first language was English, your mark on this assignment would have been better. And then students' lack of voice. For example, when students complain about racism, their complaints are being ignored by the programs. And then the other issue is that some professors misunderstand of the students, or even not even expressing compassionate or caring for the students. As such, some students are actually scared to approach some of their faculty members. There's also a lot of intimidation. That is how they feel, that if you don't do this, you are not going to complete the program, you are going to fail. And so it's hard for the students. There's also that feeling of being excluded or isolated. And this is also related to lack of no Black students in the programs. There are very few, and sometimes their white peers create their own cluster of group, especially for group projects, leaving them Black students out. So those are some of the challenges. There's also no negative assumptions of Black people. Some of the students actually talked about, that during classes, sometimes the professors or clinical instructors will talk about things like kind of to stereotype representation of Black people, like they're mainly into drugs or they're lazy, and students will be taught about that they are not fit to be registered nurses. The other challenge too is having a different accent. So they say that once they open their mouth, then it's like, no, we don't know what you are saying. As such, they prefer not to speak out or to contribute a lot during the class conversations. They also feel like the program is too loaded. There's a lot of work, and that is also a challenge for them. Yeah, so those are some of the challenges that they experience.
Thank you for mentioning the challenges that Black nursing students face in the educational setting. Now let's turn to the clinical setting. What are the challenges they face in clinical nursing education?
So just to let you know that students report more challenges in the clinical setting compared to when they're in the classroom setting. So these ones too, microaggressions. Like one of the students said, let's call a spade a spade. My barrier is being a Black student. So like sometimes they say that when you come in, they see your color, then it's like you are dumb, you don't know anything. So that then the students feel very discouraged. As I also pointed out, just like in the classroom setting, that they are feeling misunderstood by some instructors because of the accent and the color of your skin. So sometimes they try to explain themselves. They say that, we can't hear. And then so the students wonder that, even our instructors, they also have accents, but we listen. So why can't they take time to listen to what we are saying? There's also unsupportive clinical environment. There's lack of support for Black students. That's how perceived lack of support for Black students. Just like in the classroom setting, they also feel excluded and isolated because of lack of Black students. Because most of the times they will say that they will be the only one in their clinical group. So if there is a group of 7, there will be only one Black student. And if they want to do something, they don't want to include them in the discussion. And the other thing in the clinical setting is fear and actual rejection by patients. Some of the students some of the participants talked about, like the patient telling them that, no, don't touch me, I don't want to touch you. Or maybe sometimes actually being told that, like, one actually said, she was called a pig, something like that. So this is really affecting the students. They also talk about racial bias or white privilege, or double standards, whereby this is perception of being treated differently than their white peers. They say that, sometimes, a white PA can do something like medical error or something, not serious kind, but, they'll let go. But if it's a Black student, then you'll be in trouble. You might even be failed because of that. They also talked about challenges related to the learning plans, that most students, actually, more Black students are placed on learning contracts, whereby, sometimes they say that, no, you are just there in two days and already you are placed on a learning contract, sometimes without even warning. And they say that they're not even involved in writing those learning plans. They're just told that, no, can you please sign? So they feel like that is unfair. They also feel like they're being overly scrutinized by the clinical instructors. So those are some of the issues or experiences that Black students face in the clinicals. And as I've said, that sometimes they are even told that, no, I don't think you are fit to be a nurse. Maybe you should just continue to be a nursing aide or something like that. So, which is very, very discouraging for the Black nursing students. Yeah, thank you.
Thank you for mentioning both the challenges that Black nursing students face in clinical setting and also educational setting. Now, if you can talk a bit about what can be done, what can educators or institutions do to address the experiences of Black nursing students in clinical and educational setting and to improve their experiences?
Yeah, I feel like the first thing is for programs or whoever is involved to recognize and acknowledge the bias ratio towards the students, and then do more to eradicate them. Because if they don't acknowledge, then nothing is going to be done. But they have to accept that these things are happening. And they also have to initiate mandatory anti-oppressive workshops or training for faculty members. Students, administrators are involved, both in the education and also clinical setting. And the other thing is that it's very important that faculty members and instructors, even nurses, are well prepared for their role, and also to better understand students' challenges, because sometimes they will say that when the students come up with stuff, or they don't seem to understand, because I remember some being taught, I remember talking to someone, one of the nurses, who said that, okay, I think we need more education on this. Sometimes we don't even know that what we are doing is not good for them, cause some challenges for the students. So speaking out against racism behavior when we see it, they should also create space and platform for the students, Black students, to talk about their experiences. And the other thing is that programs should take students' complaints seriously and provide support that they will need. Because most of the students are talking about they're so scared, or they feel like when they go to the program administrators with their complaints, they don't take them serious. So this is, very discouraging for them. They also talk about, hiring and empowering like Black advisors to advocate for Black students, because they say that they feel more comfortable to talk to someone who looks like them, who understand their perspective. It's also important, as I said, that to increase diversity in the nursing programs by hiring more Black faculty, because right now, most of the students that we interviewed talk about having only seen one Black faculty in the program. The other thing is also maybe they can look at creating mentorship programs and support programs. They should have that self-awareness and self-reflection about their own practice in terms of anti-racism, and the ability to respond to the anti-racism. In classroom, create more cultural sensitive learning centered programs. And in the green course setting, they should try to review guidelines which are used on learning contracts for students. So our findings and anecdotal experience confirm that many Black students in nursing programs in Canada experience discrimination in their programs, which impact their well-being, mental health issues, anxiety, depression, and increased withdrawal from their programs. An improved understanding of Black students' experience can inform their recruitment and retention. Supporting Black students' success can potentially improve EDI in the nursing workforce in Saskatchewan and Canada, and also reduce the healthcare disparities in the Black population. So overall, my work is about promoting Black success and excellence. Equity, diversity, and inclusion goes beyond nursing, healthcare, and academia. As such, I avail myself as a Black voice with community groups in Saskatchewan, such as Black in Sask, and universities in Saskatchewan and beyond to raise awareness to systematic racism and advocate for students and people who look like me. Nurses are part of the community they serve. We need to build a healthy space for Black and non-Black youth and advance EDI in solidarity with Indigenous people in mutual respective ways, which are all relevant. This is fundamentally who we are in the African culture of Ubuntu. Thank you.
Thank you so much, Dr. Luhanga, for talking about Black nursing students' experiences in nursing education and also in clinical setting. And thank you for your point related to the microaggression and anti-Black racism experienced by Black nursing students and strategies to address it, such as, improving faculty diversity, reflection, mentorship, recognizing bias, and self-reflection. I hope our colleagues will be able to take some of this to improve their strategies when working with Black nursing students. Thank you.
Thank you so much.